Hey everyone, today we're going to talk about stroke. A stroke is a condition in which the brain cells suddenly die due to a lack of blood supply. When a blood vessel that carries oxygen and nutrients to a part of the brain is either blocked by a clot or bursts, that part of the brain can't get the blood and oxygen that it needs, resulting in a loss of its function or death. There are two major types of stroke. One is called ischemic, and the other is hemorrhagic. Ischemic strokes account for about 87% of all stroke cases, and they're basically just blockages in the arteries going to your brain. On the other hand, hemorrhagic strokes are ruptures in these arteries. So ischemic can be broken down into embolic and thrombotic, and these are two fancy sounding words, but a thrombotic stroke is basically just a block in an artery of the brain itself. And an embolic stroke, on the other hand, is when you have a clot from somewhere else in the body, could be your heart, could be your leg, and that clot travels all the way up to the brain and then blocks an artery in the brain. The difference between these two is just where the clot originates from. Hemorrhagic strokes can occur through something called aneurysms, which are blood-filled balloon-like bulges in the arteries. And these are dangerous because they can often rupture, leading in a lot of bleeding internal in the brain. So now that you know the different types of stroke, you're probably wondering what all this actually feels like for the patient. So all the symptoms of stroke are sudden and unexpected. The first one is weakness, and weakness usually occurs on one side of the body. This is because our brains are made such that the right hemisphere of the brain controls the left side of the body, and the left hemisphere of the brain controls the right side. So any damage that occurs to one side of the brain will affect the other side of the body. The second symptom is trouble speaking, and this can often involve confusion. The third symptom we have is vision problems, and these can often be sudden and sometimes temporary. The fourth symptom is headache, and these headaches are often quite sudden and severe. The fifth symptom is dizziness, and this can usually be seen in a sudden loss of balance. So again, we have 5 major symptoms of stroke, and here's a small diagram to overview them all. Weakness, trouble speaking, vision problems, headache, and dizziness. Although a stroke is such a devastating occurrence, it surprisingly doesn't have very visible or noticeable symptoms, as you may have seen. Thus, it is extremely important for everyone to look really carefully and really know and be able to recognize the signs of stroke in case it affects a family member or friend. A patient loses 1.9 million neurons every single minute a stroke is left untreated. It is imperative that a patient gets to a hospital as soon as possible after a stroke. Time is of the essence, so react ASAP. There's a great acronym called FAST that lays out what you should do in the event that you think someone may have a stroke. Every one of us has the ability to stop a stroke in its tracks and save a life, so knowing this is very useful. The F stands for face. Ask the person to smile. If you notice that one side of his face is not moving, get help. You can also check if their face looks uneven. The A stands for arms. Ask a person to raise both arms. If one arm drifts downward, you should get help. You can do a test to see if they can keep both arms raised. The S is for speech. Ask a person to repeat a question back to you. If they slur their words, you should check that out. The T is for time. Time is of the essence. If you see any one of these symptoms, you should call 911 immediately.